to the care provided to a patient before they undergo a surgical procedure. This care is crucial to ensure the patient's safety, comfort, and readiness for the surgery. Here are some key aspects of preoperative nursing care. Assessment: thoroughly assess the patient's medical history, current health status, allergies, and any potential risks or complications. Perform a physical examination and review diagnostic test results. Patient education: provide the patient with information about the surgical procedure, what to expect before, during, and after surgery, as well as any necessary preparations. This includes explaining fasting guidelines, medication restrictions, and preoperative cleansing procedures. Informed consent: ensure that the patient has given informed consent for the surgery. This involves explaining the procedure, potential risks, benefits, and alternatives. The patient must sign a consent form after understanding and agreeing to the information provided. Preparation: coordinate with the surgical team to ensure that all necessary preoperative preparations are completed. This includes ordering and reviewing laboratory tests, arranging for imaging studies, and ensuring that all required equipment and supplies are ready. Medication management: review the patient's current medications and adjust them as needed according to the surgeon's recommendations. Some medications might need to be stopped or adjusted to reduce the risk of complications. Nutritional status: instruct the patient about fasting guidelines to prevent complications like aspiration during anesthesia. Guidelines usually require the patient to avoid eating or drinking for a certain period before the surgery. Hygiene and skin preparation: instruct the patient on how to properly cleanse their skin using antiseptic solutions. This reduces the risk of surgical site infections. Preoperative testing: ensure that any required preoperative tests, such as blood tests, ECGs, or imaging, are completed before the surgery. Psychological support: address the patient's anxiety, fears, and concerns about the surgery. Provide emotional support and answer any questions they may have. Identification and safety: verify the patient's identity using two unique identifiers, usually name and date of birth, to prevent errors. Confirm any allergies and ensure that the patient wears appropriate identification bands. For line placement, if needed, insert an intravenous line to provide fluids and medications during and after surgery. Preoperative medications: administer any prescribed preoperative medications, such as antibiotics or medications to prevent nausea and vomiting. Preoperative checklist: complete a preoperative checklist to ensure that all necessary tasks and preparations have been carried out. Documentation: thoroughly document all assessments, interventions, medications administered, and conversations with the patient and their family members. Remember, preoperative nursing care aims to optimize the patient's condition and ensure a smooth transition into the surgical setting. Effective communication among healthcare team members and patient-centered care are essential during this phase. Intraoperative care refers to the care provided to a patient during the actual surgical procedure. It involves the coordination of the surgical team, ensuring patient safety, and maintaining optimal conditions for the surgical team to perform the procedure successfully. Here are key aspects of intraoperative nursing care. Sterile environment: maintain a sterile environment in the operating room to prevent infections. This involves proper use of sterile gowns, gloves, masks, and other sterile equipment. Patient positioning: assist in positioning the patient on the operating table in a way that provides the surgical team with optimal access to the surgical site while ensuring the patient's safety and comfort. Anesthesia management: collaborate with the anesthesia team to ensure the patient's comfort and safety during the procedure. Monitor the patient's vital signs and response to anesthesia throughout the surgery. Instrument and supply management: anticipate the surgical team's needs by ensuring that all necessary surgical instruments, supplies, and equipment are readily available. Maintain a count of all instruments used to prevent any items from being left inside the patient's body. Surgical site verification: ensure that the correct surgical site and procedure are confirmed before the surgery begins. This involves a timeout where the surgical team verifies critical information. Communication. Maintain effective communication with the surgical team members, including the surgeon, anesthesiologist, and surgical technicians. Clear and timely communication is essential to prevent errors. Patient monitoring. Continuously monitor the patient's vital signs, including heart rate, blood pressure, oxygen saturation, and temperature. Report any changes promptly to the anesthesia team and surgeon. Fluid and blood management. Administer intravenous fluids as prescribed and manage blood transfusions if necessary. Medication administration. Assist the anesthesia team in administering medications during surgery. This may include muscle relaxants, antibiotics, and other drugs as needed. Wound management. Assist the surgeon with wound closure and dressing application as the surgical procedure concludes. Documentation. Accurately document all intraoperative events, medications administered, any complications, and the timeline of the procedure. Emergency response. Be prepared to respond to any intraoperative emergencies, such as allergic reactions, cardiac events, or respiratory distress. This may involve assisting with resuscitation efforts. Maintaining patient privacy and dignity. Ensure that the patient's privacy and dignity are maintained throughout the surgical procedure, even while they are under anesthesia. Transitional care. As the surgery concludes, prepare the patient for transfer to the post-anesthesia care unit, PACU, or recovery area. Provide a detailed handoff report to the PACU nursing team. Intraoperative nursing care requires close attention to detail, effective communication, and the ability to adapt to changing circumstances. The primary goal is to ensure patient safety and optimal outcomes throughout the surgical procedure. Postoperative nursing care is a crucial aspect of patient recovery following surgery. The goal of postoperative nursing care is to monitor the patient's condition, manage pain, prevent complications, promote healing, and ensure a smooth transition from the operating room to recovery. Here are some key components of postoperative nursing care. Monitoring vital signs. Regular monitoring of vital signs such as blood pressure, heart rate, respiratory rate, and temperature helps nurses identify any changes in the patient's condition and respond promptly if there are any concerns. Pain management. Assess the patient's pain level using a pain scale and administer appropriate pain relief medications as ordered by the physician. Regularly reassess and adjust the medication dosage as needed. Airway and breathing. Ensure the patient's airway is clear and that they are breathing effectively. Monitor oxygen saturation levels and provide supplemental oxygen if necessary. Wound care. Keep a close eye on surgical incisions for signs of infection, bleeding, or poor healing. Follow the surgeon's instructions for wound care and dressing changes. Proper hand hygiene and sterile techniques are essential when handling wounds. Fluid and nutrition. Monitor the patient's intake and output of fluids. Administer intravenous fluids as prescribed and monitor for signs of dehydration or fluid overload. If the patient is allowed to eat, ensure they are tolerating food and fluids. Mobility and ambulation. Encourage early ambulation and movement as appropriate to prevent complications such as blood clots and muscle atrophy. Assist the patient in moving safely if needed. Preventing infection. Maintain strict hygiene practices to prevent infection. Use proper aseptic techniques when performing procedures or providing care, and educate the patient and their family about infection prevention measures. Medication management. Administer prescribed medications on time and document the administration accurately. Educate the patient about their medications, including dosage, purpose, and potential side effects. Monitoring and managing drainage. If drains are in place, monitor the amount, color, and consistency of drainage. Empty and document drainage as required, and ensure the drains remain patent. Patient education. Provide the patient and their family with clear instructions on postoperative care, including wound care, medication management, activity restrictions, and signs of complications to watch out for. Psychosocial support. Address the patient's emotional needs and provide reassurance. Surgery can be stressful, and patients may experience anxiety, confusion, or mood changes during recovery. Discharge planning. As the patient's condition improves, begin planning for their discharge. Ensure that the patient and their family understand the discharge instructions, follow-up appointments, and any necessary lifestyle modifications. Communication: maintain open communication with the patient, their family, and other members of the healthcare team. Report any significant changes in the patient's condition promptly to the physician. Remember that postoperative care can vary based on the type of surgery, the patient's individual needs, and the healthcare facility's protocols. The nursing care provided should be tailored to the patient's specific circumstances and the surgeon's instructions. Thank you for watching this video. Do like and comments, and if you like, hit the bell icon.